Have you ever sat in a hospital and wondered what's really going on behind that friendly smile and clipboard? Well, today we're going to pull back the curtain. We're going to uncover the incredibly complex, methodical world of nursing, a world that's part detective work, part strategy, and all about deep human connection. So, what does a nurse really do all day? It sounds like a simple question, right? But the answer is this fascinating mix of science and art that goes so much deeper than just handing out pills and checking your blood pressure. All right, let's dive in. Our guide for this whole thing comes straight from the source, a real nursing problem sheet. Now, I want you to think of this thing as a blueprint. It's a diagnostic tool that nurses use to understand the entire patient, breaking down care into different dimensions, problems, all the clues they assess, and the actions they plan to take. And we're going to follow this blueprint on a little journey. First up, we'll look at the diagnostic process itself. Then, we'll get into caring for the body, and after that, the mind. We'll see how nurses use a holistic approach to everything. And finally, we'll connect all the dots. You know, this is so much more than just paperwork. This is honest-to-goodness detective work. Every single observation is a clue, and every action is a deliberate move to solve the incredibly complex puzzle of a person's health. Let's kick things off where most of us really see nursing in action, the physical front line. This is where nurses are tackling the immediate and often life-or-death problems with the body. Now, check out the level of detail here. It's amazing. A nurse doesn't just write down trouble breathing. No way. They see the patient is using specific muscles just to get a breath in. They hear distinct sounds like a wheeze versus a gurgle. And these aren't just details for the sake of it. They are absolutely critical clues that point to the right intervention right away. And bam, those super specific clues lead directly to this clear, methodical action plan. This isn't guesswork. It's a structured response. Get specialized help. Change the patient's position to help them breathe. Clear the airway, make the oxygen less harsh. Every single step has a purpose, all designed to stabilize the patient. But physical care isn't all about machines and procedures. Sometimes it starts with a simple human observation. This quote right here just captures that raw moment. A nurse just walks in a room and immediately, instantly, picks up on a patient's silent discomfort. And this is the really crucial part. The nurse translates that observation into usable data. That wince, it becomes a 7 out of 10. And that number is so important. It's what justifies giving medication, and it helps make sure a patient isn't left to suffer in pain or, on the flip side, over-medicated, which has its own dangers. It's all about precision. So managing pain is a perfect example of mastering physical care. But what happens when the problem isn't a 7 out of 10 on a pain scale, but a feeling of fear or grief that you can't even measure? Well, this is where we see nursing make this incredible pivot, from the purely physical to the psychosocial. The skills you need to manage an airway are totally different from the skills you need to manage a family's distress, and a great nurse has to be a master of both. Okay, so that brings us to the next dimension, caring for the mind. We're moving beyond the charts and the physical symptoms and into the really complex world of a patient's and their family's emotional and mental health. The nurse's assessment here isn't a lab value. It's the absolutely heartbreaking sight of a son and daughter crying, knowing that their loved one's death is just a matter of time. Suddenly, the nurse's job has expanded way beyond just the person in the bed. And the plan for this? It's profoundly different. It's not about medicine. It's about humanity. It's about creating a supportive space, encouraging people to talk about what they're feeling, and connecting them with resources. This isn't just being nice. This is a therapeutic intervention, a masterclass in compassion. And sometimes the psychological distress is even more intense, and frankly, a lot harder to figure out. I mean, look at this. This is an incredibly powerful and concerning observation from the source material. A patient, sound on the floor in a fetal position. What on earth is going on? And here we go again. The nurse as detective seam is back in a big way. The patient won't explain. He's only offering these cryptic little clues. Money, outside. The nurse now has to piece together a whole story from just these tiny fragments to get to the root of what's happening. And the detective work continues. The nurse is documenting even more clues, rocking back and forth, shaking hands, looking like he's about to cry, just completely unwilling to talk. All of these little pieces build the case for a diagnosis of what's called ineffective coping. So what's the plan for something this complicated? It's all about being methodical and human. You don't force things, you invite. You offer a walk, You try to build trust. Because until that fear and anxiety are dealt with, it can actually cause physical problems. It can raise blood pressure, stop them from sleeping, and completely halt their recovery. This isn't just emotional support, it's a critical part of the physical healing plan. And that right there is the perfect illustration of how nursing isn't one thing or the other. It's all about tying the physical and the psychosocial together and understanding that you can't really treat the body if you're not also treating the mind. Okay, let's look at something that sounds pretty simple. A patient isn't eating. A lot of us can relate to losing our appetite when we're sick, but for a nurse, this is a huge red flag that needs a deep, deep investigation. Just look at the incredible depth of thought that goes into this. Is it a physical problem? Let's try to find food he actually likes, or maybe a supplement like Ensure. Or is it psychosocial? Let's talk to him, find out if something's upsetting him. Is it social? Maybe he's lonely and wants company while he eats. Or maybe it's the exact opposite and he wants some privacy. You see? 5 completely different potential solutions for one simple problem. This holistic approach also means the nurse is an educator and an advocate. Here, a patient is worried about a medication. The nurse doesn't just dismiss their concern. They take the time to explain the difference between a real allergy and a side effect, and then they advocate for the patient, offering to talk to the doctor about a different option. This conversation is a crucial safety net. So as we start to bring this all together, what we're seeing is that nursing is this sophisticated dance between hard science and really compassionate art. It's about connecting all these different dots to care for a whole person, not just a disease. And that is the core concept we've been getting at this whole time: holistic care. It's this philosophy that you have to treat the whole person. It means recognizing that the mind and body are totally linked, and that real healing means you've got to tend to someone's physical, emotional, and social needs all at the same time. So I'll leave you with this final thought. The next time you see a nurse calmly walking down a hospital hallway, just think, what unseen problems might they be solving right now? What intricate puzzles of the body and the mind are they piecing together, just out of view?